I want to thank you all so much for taking your Friday afternoon. I know it's been a long week here at the annual legislative conference for CBC. I know how these things go. But what we hope to do today is have a fun and interactive and innovative session that we don't typically get to do at these conferences, and have a really good conversation and dialogue. My name is Trace Bailey with Walmart Stores. I'm the Director of Food and Agriculture in our Corporate Affairs and Government Relations Division. I want to say on behalf of Walmart, we're honored to sponsor this event today. We're so thankful that each of you are here. I want to especially acknowledge a couple of colleagues, Kimberly Woodard and Wanda Simmons, who have put their heart and soul into this. I don't think they're here right now. They're still working, but they do deserve acknowledgement for putting this together. Kimberly is on the board of the CBCF Foundation and really wanted to bring a substantive conversation around food and nutrition and health and wellness, and something that's top of mind for so many of us in our lives today. I want everybody to know that this session is streaming on the web for those that are watching. Many people are also tweeting. So you can tweet it if you're interested, if you're on Twitter, ALC Healthy Eating, or CBC FALC 2012. And then for those that aren't tweeting, I see a lot of empty seats. They must still be in line for the iPhone. It was wrapped 2 blocks down the street at the AT&T down the street. I want to say really quickly on behalf of Walmart, it's an honor for us to host this dialogue today. Because food and nutrition is something that's so important to our company. We have a fundamental belief that no customer should have to choose between food that's healthy and food that they can afford. And so we have some initiatives as a company to address that around reformulation and pricing, to get the price and the cost of healthy food down. When a customer's in our stores and they're choosing between a regular pasta and a whole grain pasta, price isn't part of the equation when they're making that decision. In addition, we're helping our customers find healthier food options in the store, and working on building stores in food deserts, because so often access is a challenge. They have access to plenty of food, but not always access to affordable, healthy options. As a company, though, we've realized we cannot do this alone. We can do our part, and we have areas where we have core competencies, and we'll focus on those. But it takes strategic partnerships with a lot of players to make this effective. It takes our supplier community, who's represented today on the panel, Nestle. It takes NGO partners and organizations working at grassroots levels all around the country who know what struggles families have and can help inform families on how to make healthier choices and improve their lifestyles for themselves and their families. It takes advocates, some very public advocates, and we're proud to have Carla Hall with us today as one of those great experts and respected advocates around food and nutrition and hunger. And then last but certainly not least, maybe the most important of all, it takes the government. We have to have strategic partnerships, public-private partnerships with government agencies who have so many resources at their disposal to affect the health and well-being of Americans all across the country. And so we hope to illustrate today that collectively, in each of our respective roles, we can make a big difference in the lives of the people that are our customers, our neighbors, and our friends. On the panel today, we'll start with Dr. Wendy Johnson Askew, who's the Director of Public Policy with Nestle Nutrition North America. So in this role, she's a public health advisor for the nutrition companies. She participates with the Institute of Medicine Food Forum, the Obesity Society Corporate Advisory Board, and the American Association of Clinical Endocrinologists Corporate Advisory Board. She's a member of the International Food Information Council Board of Directors, and she's active in the American Public Health Association and the Academy of Nutrition and Dietetics. Before joining Nestle, Wendy had an esteemed career at the National Institutes of Health Division of Nutrition Research Coordination, and as a public health nutrition and health policy advisor. Next, we have Sarah Bearer Sennett, president of Old Ways, which is a nonprofit and nutrition organization with a mission to guide people to good health through heritage using practical and positive programs that are grounded in science, tradition, and real foods. We've had the distinct pleasure of working with Sarah and Old Ways on developing the African Heritage Diet Pyramid, and there's information about that on the table outside. Next, for the foodies in the room, our next panelist needs little introduction. Carla Hall, certainly best known as one of the competitors on Bravo's Top Chef. She's also a resident of Washington, D.C., and the owner of Alchemy by Carla Hall. Carla and I share something in common. She's a true believer that if you're not in a good mood, the only thing you should make is a reservation.
That's right.
And then last on the panel today, and a person I have had the esteemed pleasure of sharing a panel with before, is Dr. Nadine Gracia, who's the Deputy Assistant Secretary for Minority Health and the Acting Director in the Office of Minority Health at the U.S. Department of Health and Human Services. She's a leader in the administration on Let's Move and the President's Council on Physical Fitness. She's a pediatrician with epidemiological training. I should know how to say that. In college, I worked for an epidemiologist. But Dr. Gracia was previously a clinical instructor at Children's Hospital of Pittsburgh and a clinical instructor and research fellow at the Children's Hospital of Philadelphia, where she conducted research on community risk factors and violence. I want to ask you to welcome our panelists today. And we will...
The reason I'm really excited to be here is because I have the great fortune of actually cooking for a living, and right now, that's what everybody is talking about. Everybody's talking about food, everybody's talking about the problems the problems with the choices that people make. I'm living in New York, where they just passed the law that you cannot buy sodas over 16 ounces in movie theaters and games, any public arenas. And so I get invited to a lot of things like this, and it's pretty exciting. 2 days ago, I was just at an event for Fuel Up to Play 60. And do you know the organization? It's the National Dairy Council and the NFL have combined forces to have a program where they actually take student ambassadors and they give the students the tools that they need to make better choices. The idea is that you fuel up on really good, healthy food, making good choices, and that you move or play 60 minutes a day for a healthy body. And we're putting so much effort into our kids that I think sometimes the adults forget what they're supposed to do, and that they're supposed to be leaders. So what we have done, we've turned to the kids to say, look, it's all on you. We're going to teach you guys how to make really great choices so that when you get older, we're not paying for your health. And the reason I'm here today is to actually show you all how to take a really quick and easy and fast soup and use it 4 different ways. Because sometimes we think that eating out is faster. We know it's not cheaper, but we think that because we're so busy, we think that it's cheaper in terms of time and effort. So we eat out a lot. And once you give somebody the power to make your food, you have done just that. You've given your power away. And so I'm not saying that you have to cook every day at home, but what I want to do is just to get you excited and encouraged about actually making most of your foods at home. And they can be a combination of fresh, frozen, dry, et cetera, et cetera. So that's why I'm here, and that's why I'm excited to be here and talking to you today.
And for those that don't know, that was Chef Carla Hall that missed the introduction session. Is that okay, Dr. Gracia? Thank you.
Good afternoon, everyone. It is truly a pleasure to be here with all of you to talk about such an important issue as childhood obesity. Certainly, this has never been a more important time for us to really think about the the future of our nation's health, and certainly with our children. And I must tell you, and you probably see it every day, the dedication that exists across this administration for us to be able to help children live a healthy life. And certainly, we do that under the tremendous leadership leadership and the champion that is the First Lady, Michelle Obama. When she came to D.C. and really set forth a vision for us to have this initiative of Let's Move, where we're working to ensure that communities have access to affordable and healthier foods, but also encouraging physical activity, empowering parents and caregivers to be able to make those healthy choices and understand the information that they're being given with regards to foods, as well as really trying to change what we perceive as the norm with regards to healthy eating and active lifestyles. There are a lot of things that we can talk about with regards to the accomplishments that we've had. One of the things that I hope you'll see and was referred to earlier is the importance of collaboration, and that we really cannot do this alone. While the federal government has a key role to play, the Department of Health and Human Services certainly has an important role. We really cannot do this alone. And as you see with Let's Move, when you see various initiatives like Let's Move Cities and Towns, or Let's Move where it's chefs to school, or the faith-based community getting involved, you see that it's really a national movement, bringing together partners from all different sectors for us to be able to really solve the epidemic of childhood obesity within a generation. We at the Department of Health and Human Services have partnered with other agencies in the government, such as the Department of Agriculture, the Department of Treasury, in which we supported 16 communities to be able to give funds to help them with providing increased access to nutritious and healthy foods. We also have a President's Council on Fitness, Sports, and Nutrition, because we understand the balance that it certainly is about healthy eating, but also about physical activity. And really it's physical activity because many people say, well, I don't want to exercise and I don't belong to a gym, and that's not what we're actually advocating. It's really the importance of movement. And so the President's Council on Fitness, Sports, and Nutrition has done a tremendous job, along with the First Lady's office, in promoting the Presidential Active Lifestyle Awards. We call them the PALA Awards, really going all across the nation, encouraging youth and their families to really get active and providing them with resources and ways in which they can do so. And the President's challenge was actually that we would have 1 million Americans who would actually receive the Presidential Active Lifestyle Award in a year, and they surpassed that. 1.7 million Americans actually were able to receive that award over the past 12 months, which is a great accomplishment, and many people continuing certainly in that effort. The Surgeon General has played an important role in this, Dr. Regina Benjamin, in her work through the Affordable Care Act, which hopefully many of you are familiar with, the new health care law that the President Obama signed 2 years ago. It called for a national prevention strategy for us really to become a nation of wellness and prevention of disease, as opposed to a nation that we focus having a sick care system, if you will. In that prevention strategy, our vision is that more Americans will be able to live a healthy life. And if you look at the goals of that strategy, one, it's actually a partnership of 17 different federal agencies and departments across the government. So it's not just health and human services, it's transportation, labor, education, housing and urban development, because we understand that neighborhoods, in order to have healthy communities, you want neighborhoods that are bikeable, walkable, safe for our kids to play in. And so having this national prevention strategy, it's focusing on healthier and safe community environments, access to clinical care for those who certainly, when we think about prevention and wellness, having preventive services, but also getting treatment when those who have chronic diseases, and we know that 7 out of 10 deaths in the U.S. Among adults are actually due to chronic diseases, and many times those are preventable: diabetes, heart disease, certain types of cancer. Focusing on those types of issues so that we can really help to reduce the leading causes of death in the U.S. We also have a variety of other initiatives that are happening, some that are being administered through our Centers for Disease Control and Prevention. We have what we call community transformation grants, because we recognize that part of what we talk about when we think about healthy eating and active lifestyles is about your individual behavior and personal responsibility, but also it's about the community that you live in, the design of that community, and the resources that that community has. And so recently our department, through the Centers for Disease Control and Prevention, awarded over $100 million, $103 million to communities around the country that will serve about 120 million Americans to really think about that community design and how to promote health and wellness in those communities. Our Food and Drug Administration also has been looking at the issue of menu labeling as far as nutrition labeling on products, and so they are working on that effort as well, because we also want to provide consumers with information. So as you can see, there's quite a bit that's happening, certainly not just within the Department of Health and Human Services, but across the government. And in many of these initiatives, we're partnering with cities, with states, with local communities, because we recognize that we need you in this effort so that our children can live healthy lives. Thank you.
Technical difficulties seem to be resolved. I've killed 2 computers today now. So, Dr. Johnson-Askew.
Hello again. Good. I guess it's true what they say, you can take an academic out of the academic setting, but you can't take the academic out of the person. I needed my slides to talk to you. Well, first of all, as we think about this whole issue of nutrition, which is very near and dear to my heart, I think there are some points that we have to frame our conversation around. And that being, number one, that 6 out of 10 leading causes of death have either a nutrition-related cause or a nutrition-related treatment or prevention. Racial and ethnic minorities bear the greatest burden of nutrition-related diseases. This includes diabetes, this includes obesity, this includes heart disease. Food access is not equitable. I think that was one of the things that Trace mentioned early on in the conversation. So it's not just go and start to buy more fruits and vegetables. You have to have those things in your community in order for you to be able to consume them. Culture is important. So you'll hear more of this when Sarah speaks about the cultural pyramid. But if you think about it, we have cultural differences in how we perceive beauty, how we consider food. All of this is important. And as we have this shifting of demographics, we know 2 things. Number one, when people migrate to this country, their diet goes down. It gets worse. So there's something about the way we're eating that is driving us to poor health. The other piece of that is as the demographic shifts, so does the culture. So we're seeing new and exciting ways of eating and also bad patterns that are being spread to other communities. And with regards to obesity, there is a cultural component. So the Institute of Medicine earlier this year put out a statement that basically states that it is important for us to start to deal with early childhood nutrition because this is important as it impacts later life. We at Nestle have done a lot of work looking at this issue and looking at what our younger children are eating, and surprise, they eat just like us. So this is a slide that I want you to pay attention to pretty closely. It's busy, but I'm going to point out a few things. In the first red bar, you will see the percentage of a child's energy intake, meaning their calories, that's made up from certain food groups. So here we're talking about sweets. So at 18 months, children are consuming 12% of their calories on the average from sweets. Now, I don't know about your kids, but my kids weren't feeding themselves at that point. So we're doing this to them. The other thing that you want to pay attention to in the yellow bar is that the vegetable consumption is about 7 or 8%, which is not what we recommend when you think about the whole message of having half your plate fruits and vegetables. Even more profoundly than that is if you start to look at about 15 months, the dietary pattern that you see for young children seems to solidify at around 18 months, and we know that it holds firm until they're 4. Now, I used to study adults. That diet and the adult diet is the exact same. So all of the interventions that we're doing where we're starting later in the process are all great. We need to do those, but we need to start earlier. We need to be doing something earlier with our younger children. As we think about this problem, though, you have to think about it in the framework. These are just a couple of statements. I did a study back in 2010, actually with a colleague from Walmart, when I was still at NIH, where we actually assessed what advocates for Black children felt about obesity. A couple of strong things that came out. First of all, most parents' lives are very complicated, especially in the African American community. When you start to look at teenage pregnancy, you start to look at violence, you start to look at other things, obesity falls down very low. The trend seemed to be that more attention or more focus was on those things that caused immediate risk to our children, which is understandable. What is less clear is the impact of poor eating, underactivity on our children longer period of time. So we focus on the immediate because our lives are so complicated, when we need to be also thinking upstream because this impacts the quality of life of our children as they get older. The next statement, I believe the problem of childhood obesity among African American children has been overstated in the media. 20% of us believe that. 20%. Now I'm doing some work with Newark and I'm just going to show you a slide, but 27% of the children between the ages of 3 and 5 are already obese, not overweight, they're obese. So what we've done at Nestle is we've taken our learnings and we've put together a community education program with Mayor Booker and his Let's Move Newark campaign, where we've actually developed a curriculum for parents of young children. We've graduated to date 40 people from that curriculum. It's 6 weeks. We focus on hunger and fullness cues, introduction to solids, the importance of breastfeeding, appropriate snacking, and how to make that transition to table food, because that seems to be when we get in trouble. In addition, this program has a community advisory board. We're sticking pretty closely to the community-based participatory research model in that the community drives what that program looks like. And they have input in every decision that's made. The first year of the program is about to come to an end. In the second year, we have an economic model where we will have community peer educators who will be paid through the Let's Move campaign or Newark Now campaign to deliver it to the other parents coming through. Now, the good thing about that is we've also been able to partner with UMD&J, the University of Medicine and Dentistry in New Jersey, to get continuing education units for these educators so that they can then take this training and move forward. I look forward to your comments. Thank you.
Thank you very much. And thank you so much, Trace and Kimberly. I'm thrilled to be here with you and be on this amazing panel. Not just to be here at the Congressional Black Caucus, but I'm thrilled also to introduce Old Ways and our programs to you, because our mission, our programs, our resources really fit exactly what this panel is all about, encouraging healthier lifestyles through food and nutrition. As Trace said, Old Ways is a food and nutrition organization based in Boston. We've been around since 1990. It was founded by Don Gifford, who was in his early life legislative assistant to Ted Kennedy and national campaign coordinator for Bobby Kennedy during his presidential campaign. And after he's in Washington, he went back to Boston, owned restaurants. He was friends with Julia Child, and really has loved food all his life and wanted to bring together an organization that connected food and culture, environment, history, and health, and this is Old Ways. And our mission, let the Old Ways be your guide to good health and well-being. We're a nonprofit, as Trace said, with a mission to guide and inspire people to good health through heritage, because after all, diabetes and heart disease really is not a part of our heritage. Our programs are practical and very positive, and we advocate healthful pleasures of good food. And since one size doesn't fit all. We work with cultural models for healthy eating, good for people, good for the earth, good for preserving traditions and ways of making food, all motivation for healthier lifestyles. So in practical, Trace asked me to be very practical, the kinds of what we do, and I'm going to go through our heritage pyramids, the Whole Grains Council, Latino nutrition. We work with supermarkets and also our newest African Heritage and Health program. We started with the Mediterranean diet because we always start with science. We're grounded in science, but also care about food because we eat food, not nutrition. There was the most science about the Mediterranean diet in 1990. And with the Harvard School of Public Health and the World Health Organization, we introduced the pyramid. This is all of them. We believe in the power of tradition as a force for change, and so we also have an Asian, Latin American, vegetarian, and our newest one, which I'll talk a little bit more about later, the African Heritage Diet Pyramid. And at the foundation of all these diets are physical activity, Let's Move being very important, and also attributes like eating with your family, gardening. There are lots of healthy activities that contribute to an overall healthy diet. At the base of the pyramid above this activity are plant foods, grains being among them, and whole grains in particular. For many years, dietitians, government, doctors have said, you don't eat more whole grains. And the needle really didn't move. So in 2003, we formed the Whole Grains Council, and it was created to help consumers find whole grains because we discovered they would go into the grocery store and not be able to tell, you know, a loaf of brown-colored bread from what would be really whole grains, or what other kinds of grains are whole grains, like quinoa. Everybody's into quinoa these days. So our education programs have helped that. The whole grain stamp is on more than 7,000 products in 30 countries, saying that there's at least 8 grams of whole grains in each serving in that product. Recognizing the power of heritage, we also introduced the Latino Nutrition Coalition, putting together bilingual resources, menus, recipes, shopping guides. We handed out millions of shopping guides in supermarkets across the country. And since people buy food at supermarkets, we've started working with a number of supermarkets, including Walmart. We have several programs. We bring together supermarket dietitians with industry once a year for them to work together to figure out how to sell more healthy products in stores. We have an online portal for supermarket dietitians who, if you haven't met supermarket dietitians, I think they're going to join Carla as one of the food rock stars of the future, like chefs were 20 years ago, really not so well known. But these dietitians have the power to influence millions of consumers. When we started the Whole Grains Council, our goals were to make whole grains as mainstream as olive oil, and to be on Oprah, and we did both. And now we are really, really excited about the African Heritage Diet Pyramid. We developed this through a grant from Walmart, the Walmart Foundation, and it is based on the culinary traditions of the African diaspora. We brought together an expert committee of culinary historians, nutrition scientists, and we have one in the back, Christy Lancaster from NYU, and also public health officials. And we looked at what would be, based on these traditions, what are the foods and the activities that are a part of a healthy diet. Last year, when we introduced this, we also put together a number of resources. Besides the pyramid, we have a brochure that I think you received in the blue bag from Walmart. We have 12 plates of expression, 3 dishes from each of the 4 regions of the diaspora, Africa, the Caribbean, the American South, and parts of South America. A rice and beans dish, very simple. Soup, like Carla will make soup today. And also a protein dish, a fish or a meat. Materials to help set up a kitchen, recipes. We have a lot of information on our website also about science. This year, our program manager, Sarah Dwyer, attended the Essence Music Festival and heard the consensus she heard was that the majority of people are not cooking, but they really, really want to. They know the importance of it, they know it's great for their family, they know it's more cost effective, but they just don't know where to begin, what to do, what to cook. You know, for instance, here are a few comments. This is really interesting. I need this pyramid. My doctor told me that I need to lose 15 to 20 pounds to get myself out of pre-diabetes. Eating this way looks more doable than any of the other diets I've read about. Yes, this is how the older people in my family always ate, and they weren't in the same bad shape as my nieces and nephews are today. We've got to get back to these ways. So this year, also with the help of a grant from the Walmart Foundation, this is the brochure, we've created a community cooking curriculum, A Taste of African Heritage. It's basically introducing the different foods of the pyramid. There are 6 lessons, learning how to easily prepare this, which will, as is the title of our session, encourage healthier lifestyles through food and nutrition. This community cooking series is being piloted right now in 15 cities, in churches, community centers, hunger organizations, beauty parlors, a museum, family centers, in places like Marion, Iowa, Clarksdale, Mississippi, Milwaukee, Tyler, Texas, here in Washington, Boston. The pilots have just started, but these are what we've heard. The fact that you've included things like pot liquor and the Sankofa symbol show the cultural detail put into this. I've taught nutrition classes using other curricula and where I had to talk out of both sides of my mouth. I feel that our tenants will really enjoy and identify themselves with this curriculum since your vision is culturally sensitive. Next year, we want to expand the curriculum and also expand our reach. We'll be working with the National Organization of Blacks in Dietetics and Nutrition, NOBIDAN. Want to work with more state health departments, WIC, the federal government, dietitians, doctors, community action groups, churches, beauty parlors, the food world, more chefs and restaurants, and national organizations like the NAACP. Thank you so much for listening, and I hope you've learned a little bit about Old Ways and our programs and how excited we are about the African Heritage and Health Program. We'd love to work with you to improve healthy lifestyles. Thank you so much.
Sarah, thank you so much for that. We have about 15 minutes remaining. I'm going to take the moderator's prerogative and ask the first couple of questions, and then we'll turn it over to the audience. But we heard a lot today. Access, affordability, cultural appropriateness, obesity, what people believe and don't believe. Talked about community engagement. This is an open question to the panel, all the panelists. What are some of the ways that we can collectively exercise interventions, appropriate interventions at an early childhood level? Because we heard in Wendy's presentation that so many of these trends start before kids can choose foods for themselves. What comes to mind for each of you, and what tools do each of your respective organizations have that can be employed as an intervention to help turn the tide? We'll start with whoever wants to start.
Well, I think cooking is essential, and we need to make food. And we were talking before the session started, and I think that families have to look at priorities. And I think that it's a big, complicated world out there, but that to look at food and meals together as something that's just as important as school and sports, and it's just an important part of life. And family is so important, and it's a great place to be together at the table. And it brings health as well, and fun. Tastes good.
I'm very much involved in the youth garden here in DC, and like I said, Fuel Up to Play 60. And I think a lot of times we assume that that child has to have that kids meal, which, oh my God, oh sorry. If I could just take the idea of a kids meal and strangle its little head off, I would, because I think that with the youth garden, the wonderful thing about it, and the beautiful thing when we would have the chefs go on Wednesdays, the kids would see the vegetables growing, and they had a connection to it, and then they would take those vegetables and then turn them into a dish, and then they would go home and they would tell their parents, "Hey Mom, why don't you buy eggplant?" And they're like, "You like eggplant?" Parents don't even realize how much is possible just by involving their children in the process of food. And just like you were saying, if you take making dinner a project versus making maybe your flute lessons more important because they have to get so much culture outside of the home, and having that basic idea of creating meals and knowing where their food comes from, and understanding like what an eggplant looks like, or what a fresh piece of fish looks like, I think we'd be a lot further along.
Now I'll jump in, and I want to speak to the very young children, those who are not feeding themselves. I mean, I think that everything that has been said is actually very true. I think that as I think about how we approach nutrition in this country, we have not really focused a lot of attention on the nutrition of very young children. We have no dietary guidelines for children under 2. And if you look at the literature base, which some of us really enjoy, towards the end of the spectrum, because the dietary guidelines currently are for children 2 years old until the end, for adults to the end of life. Very little research has been done at those very young ages. So it is important that we think about what young children should eat and that we invest in that. Part of that is the importance of breastfeeding. And yes, I do work for Nestle, and we are a formula company. But breastfeeding is very important. It is a very important first start for a child. What formula does for a child is replaces and tries to mitigate what breastfeeding is not when it's not available. So, and that gets into a whole nother spectrum of why is it we don't breastfeed? It's not because we don't necessarily do it as a culture, we don't believe it, but there are workplace policies. There are a whole lot of other things that are contributing to that. So if I were to say what I think we should do is really look at young children and look at the complexity of young families and see what we can do to help families to have better nutrition for their youth.
I would, and I agree with many of these points, and I think that from our perspective within the department, we certainly understand, and actually Secretary Sebelius, the Secretary of Health and Human Services, really has prioritized early childhood development and looking at that in infancy and early childhood. Breastfeeding, the Surgeon General actually issued a call to action on breastfeeding, and it was specifically noted the disparity that we see in breastfeeding rates between African American mothers and white mothers, and seeing that there are cultural issues, there's awareness issues, there are economic issues, but part of it is the awareness of understanding the health benefits of breastfeeding, having the supports, and part of what we have been doing is really trying to raise awareness, for example, with regards to some of the health benefits, not only for the infant, but also for the mother herself. Under the healthcare law, we announced in August women's preventive services, and included in that is now breastfeeding supplies, support, counseling actually provided at no cost because of the healthcare law, so trying to remove those barriers. But we also promote certainly this early exposure to the fruits and vegetables and understanding what that means as far as health. So I think there are certainly many ways in which we are also engaged in thinking about this from the younger, at the early childhood development stage.
I see we have the audience ready to ask questions, so I'll forego my next one and let the audience participate.
Good afternoon. My name is Doralina Samus-Posey, and I work for the Directors of Health Promotion and Education here in Washington, D.C., and the former Chronic Disease Director for the state of New Jersey. Yeah, and I'm glad to see what Newark is doing, and Mayor Cory Booker. I'm really proud of that endeavor. And I have two questions. The first question is the State Department of Health and Senior Services obesity program involved in this endeavor, and will it be replicated across the state? And then the second question is, I'm so supportive of everything that's been said today. I spent my formative college years at Harvard School of Public Health, and I'm really proud of the African American heritage diet, which is looking promising for me. But my problem is food deserts. We have a big problem. We're talking about wonderful, healthy foods and things that we should be doing, but a lot of the problem is the accessibility of fresh fruits and vegetables for minority communities, and that's a major concern. And what are we going to do about it?
Well, I'll take the first part of your question. I have an opinion about food deserts, but that's really not why I'm here. But I will take the first part of your question as to who is involved in New Jersey. We have involved the Department of Child Well-being, so we have our health departments involved. We have a pediatrician on our board. We also have food stamps. We have the extension people. We have WIC on our board. We have incorporated every agency that touches a child is present. And not only that, and this, I'm really proud of this, we actually have community members on our board who actually are helping us shape this program. And it has been it's been a rigorous process, even down to the governance of how we're going to interact and who has the power. So we've taken this quite seriously. And as far as replication across the state, we're doing it right now in 15 family success centers. We have gotten IRB approval, so we are going to be collecting data about whether or not there is a change, an intention to change behavior with the members. And we're going to now do a similar exercise in Michigan. So, thank you.
And I'll take part of that question around food deserts. As a company, we've made a commitment to open just around 300 stores in food desert areas over the next 5 years. We've opened 60 of those since we made that commitment with the First Lady in July of 2011. And it's an important part of the conversation around access. I think when we started hearing the term food deserts and started talking about food deserts, it really put a spotlight on access. Now, access isn't just about putting a store in a location, and we have to focus on something more comprehensive than that. And again, from our perspective, it's about pricing, and it's about making those healthy products available, and they have to be affordable. And then you can have affordable, healthy food on every corner, but if people don't know what to do with it when they get it home, then it's an inaccessible product. So I think it takes comprehensive solutions along a broad spectrum of stakeholders to help solve this. Let's get to the next question.
Have Walmart do food demonstrations like Wegmans does. It brings the customers in.
Yeah, well, the Wegmans food demonstrations are really good. I'll admit.
Hi, everyone. Thanks for having me. Good afternoon. My name is Aine Abbey, and I'm with the Praxis Project. We're based here in DC, but we work with community groups across the country. I wanted to kind of follow up on kind of what Wendy was bringing up about kind of healthy systems, not just healthy individuals. You know, a lot of the conversation most of the time is about like individual responsibility, but how can we create healthy systems to not only think of us as consumers, but think of us as workers. There's a campaign led by Walmart employees called Our Walmart, led by Black women here in Maryland and around the DC area. You know, they're fighting for fair wages. A lot of the things why it's not just access, we can't afford the food. What does that mean when we don't have fair wages? You know, what does it mean for commercial workers working in factories that Walmart then contracts to, where they also don't get paid, don't have safety mechanisms? How can we create and change the conditions in our communities that will allow us to be healthy?
Again, I'll take that, and I'm happy to, you know, talk with you after this at length if you'd like. And I have other colleagues here that would probably welcome that opportunity as well. I would say, you know, at Walmart, we've announced we're building 6 stores in the District of Columbia, many of those serving food desert areas. And we're proud to be bringing 1,800 jobs to DC. In terms of wages, I would say that, you know, we want to be competitive, and we want to, you know, pay competitive wages than, you know, with our peers in the retail sector, because if we don't, they won't work for us. They'll go somewhere else. I'm also proud to say that we offer benefits to all of our associates in healthcare for all full-time associates at Walmart. And I would say what's different about Walmart than other retail operations, most of our associates are actually full-time. And that's not the case for a lot of other retailers, when most associates are part-time and don't have access to healthcare. But if you want to talk about it more at the end of this, happy to do that. And let's move to the next question if we can.
Cool. Please visit ourwalmart.org. You guys can find information about what's going on with Black women around here, and the Food Chain Workers Alliance to find more information. Thank you.
Thanks.
Good afternoon. My name is Cheryl Adams. I'm with Bread for the World Institute. And my question is essentially, are there any initiatives to help families using EBT benefits to improve their health and wellness, such as cooking and learning how to shop and things of that nature? Thank you.
So as part of the Let's Move initiative, one is that consumer empowerment and engagement. So it's not just to say you should go and get healthy foods, but it's actually how to do that. That's one of the key pillars in providing information, providing resources to know how do I actually make a healthy meal. And so that is one of the key pillars of the Let's Move initiative, is to really empower families. And that's whether it's an individual or a parent of young children or for adults themselves.
Hello, my name is Ransom Miller III, and I'm the founder of Project Give Back. We distribute 1,000 food baskets to needy families in the Washington, D.C. area every year. We're gearing up this year, and I believe everything happens for a reason. I believe I stumbled upon this for a reason, because I think the African Heritage and Health program needs to get to all 1,000 of those families, because I think they fit where you're trying to get to. My first question is, how can we get more information to our constituents about your program and incorporate that into the baskets that we will deliver this Thanksgiving? My second question is really, well, it's really a plug for Walmart, because Walmart, that's where we got our turkeys from last year. And they had the best price, even better than Wegmans, actually. So.
Thanks. That wasn't planned.
I'll give you my card, and if you'd give me yours, I'll be happy to send you information that you can put in the baskets. And we'd love to talk with you about piloting and running one of the cooking series. It would be wonderful. We'd love it. Thank you.
I think we have time for one more question, maybe 2 if we make it fast, and then we have to have some real fun.
I actually have 2 questions. My name is Bob Butler. I'm a reporter for KCBS Radio in San Francisco. I'm the Vice President of Broadcast for the National Association of Black Journalists. We have a very robust health program for our members so that we can help them stay healthy, so they can spread messages of good health to our readers, listeners, and viewers. You talk about food deserts. We also have food swamps. We have all these companies now, these fast food restaurants, which have their healthy meals. First question, just how healthy are those healthy meals from these fast food restaurants?
Okay, I'll take it. I don't have a restaurant, let me say that. But I am a nutritionist. And I will tell you that I have been impressed with the changes that have been made at some of these restaurants. And I have taken, looked at the nutritional information with a fine-tooth comb. Now, and they've been much more upfront about if you have a salad and you put 8 tablespoons of dressing on it, then it has more than a couple of Big Macs. So, and excuse me, I'm not picking on a brand, but I'm just saying, I think that some of the work that I've seen recently, I have been very encouraged by. I think that most of the companies are beginning to take this responsibility because, they hire people too. They have employees too. They are providing healthcare coverage for their employees as well. So everybody has a vested interest in making sure people stay healthy and productive and all of those kinds of things. Now, it is true. People will produce what people buy, but there's much more of a demand. There's a pent-up demand now for more of these healthier products. And so I think, honestly, I'm beginning to see people rise to the level of supporting those healthier choices.
So real quick.
I would add, too, that while I think that cooking at home is really important, that perhaps seeing an apple and walnut salad at McDonald's, I saw today little packets, and I think McDonald's buys more apples than any other organization in this country, but that you would then go home and serve apples and walnuts to your family, not necessarily having to go to McDonald's to make that. It's sort of a new, as chefs are inspiration for lots of people.
So you mentioned, I've heard a couple of people mention healthcare reform. We're in election season. What happens if the Democrats lose? We've heard healthcare reform is going to go away. What happens then?
So our focus since President Obama signed the law is to implement the law. This is one of the most significant pieces of legislation that we have to really advance prevention and wellness in this country, and also to reduce health disparities, providing better access to care, providing better quality of care, making health care more affordable, and we're already seeing the impacts. If you look at preventive services, for example, we know that minorities are less likely to get the preventive services, blood pressure screening, diabetes screening, cancer screenings, than they should to actually stay healthy. We've seen in the African American community 5.5 million African Americans who now currently have access to those preventive services at no cost. We know the numbers, we're seeing the impact. We're investing in communities, investing in new healthcare, federally qualified healthcare centers. Just in June of this year, $128 million went to healthcare centers, federally qualified health centers, to provide care, expanding services to another 1.25 million patients. This is important because when you look at these community health centers, more than half of the patients seen at those health centers are racial and ethnic minorities. So the impact of the law is already happening. Our work at the Department of Health and Human Services is to continue implementing the law because we cannot wait. We have to reverse the trends that we have seen, and really the way for us to overcome these disparities is to have this type of really focus on prevention, wellness, and access to care, but also looking at the social determinants, the broader social determinants of health. So where people live, where they learn, where they work, and where they play, all of those things influence a person's health, not just what happens in the doctor's office or in a hospital. And so that's why you're hearing about all of these other initiatives too that are focusing on communities to build healthier, resilient communities so that we can truly have a healthier nation.
We have time for one more question. I know Carla has to start cooking, so we give her plenty of time to show us a great, healthy, and affordable meal. So this will be our last question.
Okay, so very quickly, my name is Angela Hughes. I'm 26 years old, and I've been a vegetarian for 5.5, almost 6 years. And of those 5.5, 6 years, almost 6 years, I was vegan for 6 months, for half a year, but I love cheese too much. Earlier in the session, it was mentioned a number of times about prevention, preventative, that's definitely been a constant, as well as a focus on childhood obesity, as well as parent education. As a 26-year-old young lady who is a vegetarian, I'm often the minority, if not the only person amongst my circle of friends who actually eats in this way. When talking about prevention, I think that alternative eating habits and diets are definitely a way to prevent the steady increase of obesity, heart disease, of various cancers that are happening within our community. What have some of the organizations and things that you all work for, how important is it to, or what are you going to do to emphasize the importance of alternative eating, like raw food diets, vegetarian diets, and vegan diets in terms of combating a lot of the issues, the health issues that we have in our community?
We have a vegetarian diet pyramid, and truly most traditional diets are plant-based, and it's the main focus, and that plants are the center of the plate, and that for those who do choose to eat meat, and I love cheese too, I couldn't be a vegan, that they're smaller amounts, and it's flavoring and more occasional. I think that it seems to me, I don't know in all communities, but that there's more interest in plant-based diets. And I think there's a lot of interest in the media. There are books coming out. Cooking is probably the best way to focus, learn more about a plant-based diet. Is that helpful?
Well, I mean, I feel like there should be a focus on alternative eating habits. And I mean, you're a chef and you're a nutritionist, and I've read a number of studies that talk about how literally having a vegan and vegetarian diet, it lowers the risk of having various cancers, various heart diseases, various deaths.
I mean, I think you're right. I think that one of the things that I find, when a vegetarian, some vegetarians don't know how to be vegetarians. They're not healthy vegetarians. And just because you don't eat meat doesn't mean that you're healthy. I mean, they fill up on carbs and sugars and all of that. So they don't get enough proteins. They don't really know. So I think the idea of having a pyramid to show you how to be a vegetarian is a really great idea. Secondly, I agree with you in that sometimes you'll go to a restaurant and you'll say, I would like the soup, the tomato soup. Is it vegetarian? And somebody will say yes. And it's made with chicken stock. Because they don't understand, this is not vegetarian. It has chicken stock in it. Yeah, but it's just the stock. So I think, it's just everything that's all in it. So I agree in that if there's more education about how you can be a vegetarian and more people talk about it, I do believe that in a lot of restaurants they do make an effort to have more vegetarian options, more vegan options. Before, I mean, even as recently as maybe 4 years ago, you were vegetarian and you would get a bunch of sides and they would go and throw something together for you and it wouldn't be a composed dish. So I think that the vegetarians are a little louder, but you're right. There aren't as many choices, or it's an eye roll when you go to a place and it's like, oh, I'm the vegetarian, and I go, well, let me find something for you to eat. I mean,
In our African heritage, in the 12 plates of expression, only 3 of them have, 9 of the 12, 3/4 are vegetarian.
And I would just like to quickly say, as a nutritionist and as a nutrition researcher, there are unhealthy vegetarians, just like there are healthy meat eaters. So I think allowing people to express themselves with food is very personal, and have a choice of what they want to eat, but be the healthiest at your choices as you possibly can is more where I'm focused. And that comes from allowing people to be. So, while I think that works for you, that might not work. Definitely, I like hamburger. It wouldn't work for me. But, to each his own. And I try to eat the healthiest, leanest hamburger that I can. But I think there are ways that you can be healthy in all diets.
Speaking of hamburgers, we're getting hungry. Carla, let's show us what you do. People join me in thanking this very great panel.
Thank you.
We come home from work. Even though I cook for a living, I have to tell you that I don't always cook at home. My husband, oh, sorry, Matthew. My husband cooks at home, and probably because to eat all the time. And so often, it honestly is probably faster to eat something at home. So I want to show you a dish. Can you open those for me? Yes, thank you. So I'm going to start with oh, I gave him my pot. No, I didn't. Hold on. I want to start with a tomato soup, and I want to show you all how easy. How many of you have never made a tomato soup? Oh, wow. Okay, okay, that's awesome. You love tomato soup, you never make it? Okay, it is so easy. I'm so glad that I'm here then, and I chose tomato soup. I love tomato soup. I didn't like it as a kid, but I like it now. All right, so I want to show you how easy it is to make, and then we're gonna, let me chop this up. All right, so we're gonna start with onions. If I mention anything that you all don't know, let me know. We have yellow onions. Okay, don't raise your hands because you all know. And we're gonna start with peppers. We have canned tomatoes, and we have some carrots, some jalapenos, and some celery.
Would you rather go to the store and buy tomatoes rather than can or?
Yeah, actually, that's a really good point. Now, this year, his question is, wouldn't it be better just to go and buy fresh tomatoes? Absolutely. My idea of giving you this recipe, now I've been doing fresh tomato soup all summer long because tomatoes right now, because of the drought, are really, really good. Any vegetable that has a lot of water, right now they're really good because they've been starved of the water, so the flavor gets really intense and fruity and nice. The peaches have been amazing, the nectarines, the tomatoes, really, really yummy. But the purpose of me doing this recipe and using canned tomatoes is to show you that you can use some fresh, you can use some canned ingredients, you can use some frozen. You have no excuses, basically. That's what I'm pretty much telling you. But you can definitely do this with fresh tomatoes. Now, I'm going to start with some onions. I'm just going to cut these up. And my little helper, I'm going to have you peel a carrot. I'm going to show you how to peel a carrot. Are you right or left-handed? Doesn't really matter. You're right-handed? You guys, what is your name? Wanda. Wanda! Hey, Wanda. Okay, let me move this over here so it's easy. You guys know when you're peeling a carrot, just to let you know, the peeler works when it's going down and it works when it's coming back up. Do you know that? All right, so you can peel a carrot like this. Do you see how fast that was? Yeah. Okay. Sometimes it's all in the prep. Sometimes we don't want to cook because we don't like doing the prep. We're like, oh my gosh, it's going to take us so long just to cut up everything up. Yeah, that's how you feel, right? And sometimes when you go to the grocery store and you see all of those vegetables that are cut up, you're like, oh, I don't want to get that because it's cheating. But honestly, if it's worth your time to buy some cut up vegetables, then go ahead and buy them, right? All right, so we have our onions. And what I have here are onions, carrots, celery, and this is what we call mirepoix in the French. You know, there's a song. I believe in mirepoix. No, you sexy carrots and onions too. Celery. Just a little something for you to remember. Mirepoix. All right, you could. I don't have another knife. I know. I should have sent you a knife, but okay, sorry. All right, so we're going to cut this up. Now, if you are making the soup and you cut everything up nicely, you can use this base as something for a chicken stew or something like that. Or if you know you're going to puree it, which we're going to do today, it doesn't matter what it looks like. All right? So, Wanda, I'm going to have you over here. I'm just going to throw everything in here. You're going to be cooking with gas. Well, electricity. All right, so we have our onion. You can switch me over here. Sorry. So Wanda's going to do everything because I think you'll trust her because she doesn't cook.
every now and again.
All right. So you're going to add a little bit of olive. You're going to wait till the pan gets a little warm. Then she's going to add olive oil, and then we're going to add in our onions.
Carla, I have a question.
Yes.
You know how hard it is to wash beans in a sink with an automatic soap dispenser?
Yes.
Yeah? I didn't get soap water. The soup won't taste soap.
All right, so we have our onions. We're going to cut up our celery. Is anybody chiming in? That's good. Now, I have Wanda putting the oil in the pan after it's gotten a little warm because when the pan is warm, you can tell how much oil you put in there. When you put the oil into a cold pan, all of a sudden it doesn't seem like enough. Then all of a sudden it gets hot. You're like, oh, who put all that oil in? Did somebody put some oil in when I just turned my back? No, it was you. Because, you know, the pan heat up. All right, so you're going to just put those celeries in there. All right, we're going to add some carrots. Because when you think about tomatoes, they're a little bit acidic, and sometimes you want your soups, whatever you use, you just want them to have a complex of flavors. So that's why we have the carrots, that's why we have the celery, and that's going to be the base of our soup. Now we're going to add, and let's talk about salt. Where's my salt? Oh, I have salt. Yes, it's salt. That's why you're here, Trace. That's why you are here. All right. So let's talk about salt. We talk about hypertension all the time. We talk about people over using salt. This is my thought about salt. When you know how to use salt, it is a beautiful thing. So the Chew did a show with Dr. Oz. We're going to sprinkle in here. I don't know how to use salt. You don't know how to use salt? When I put an ingredient into the pan, and these are fresh ingredients, I sprinkle a little salt. That salt goes into the fiber of the food. When you wait until the end of cooking and you try and it's at the table, you end up putting the salt on top of the food and you keep adding and adding and adding because you're waiting for some magic to happen. And that's when you're over seasoning. That's when you're over salting. When you use processed foods and they're preserving your food with salt, what you have decided is that you have already told me how much salt should go in the food, so now I don't need any salt. You gave your salt power to whoever processed that food. You did it. Nobody else did it, so now you can't use any salt. So now if you're over salting, it's not that company's fault, it's that you are adding more salt on top. So that's when people start to over salt and that hypertension they get. Okay, so Wanda, how you doing?
I'm doing good.
You are doing good. All right, so in here, I want to add, do you like it spicy, Wanda?
A little kid.
Yes, she does.
Just a little kid.
Oh. That sounded personal.
That was Texas coming out.
All right, so we're going to add a jalapeno. I'm going to keep the seeds in because they like it a little spicy. I'm just going to use one. All right.
Just one.
Just one. Just one. You don't like spicy?
Oh, I love it.
Oh, okay.
Put two in there.
All right, so we've got this going. At this point, if I want to put some herbs in, I can put my herbs in. I have some oregano, just a little bit in there. I've got some cumin.
Oh, that's a good one.
I do too. Got some cumin. I'm going to add some black pepper. Does it smell good? You know, there are a couple things that you put in the pan and it just makes people think that you're like throwing down.
Yeah, that is so true.
Cumin is one of them. I know. Onions and cumin. All right, I'm also going to add some garlic, which I didn't add already.
I'm a little sticky. Don't worry about it.
Don't worry about it.
Okay.
That's flavor in the brown, girl. That's flavor in the brown.
Flavor in the brown.
So we're going to add a little bit of garlic. Now, what about this is it's hard right now. Anybody, is it hard right now? Right. All right.
But this is a great chore for kids.
It's a great chore for kids. Kids can peel kids can peel garlic. So we're going to slice up our garlic. We're going to put that in there, Wanda. Right now, you have all that in there. I'm going to add in my tomatoes.
You can do this with fresh tomatoes?
You can do it with fresh tomatoes.
Okay.
Yeah. I just did it with the yellow tomato soup. It was delicious, if I must say so myself. Toot toot honk honk ooga. That's me tooting my own horn. All right, so we have that in there. Now, at this point, we have our carrots, onions, celery, jalapenos, some garlic, and our tomatoes. And we're going to add in some stock. You do not have, and I have veggie stock, by the way. Where is she? Oh, I have veggie stock! Veggie! Sorry. But I know how sometimes that annoys you. You're like, is this a vegetarian soup? And they're like, yes. It's like, was it veggie stock? Because you have to ask these days. It's like reading the label talking to people sometimes. Okay, anyway. So I'm going to add, I don't normally buy stock, but because I'm here and we're not in our kitchen, I'm going to add half stock, half water. All right, what about this can you do? It's easy, right? Okay, awesome. Now, at this point, we're going to bring this up to a boil, we're going to cook that down, and then we're going to puree it. But let's say we don't add all of the stock. Let's say you have a chicken, and I have a chicken, but we won't go through the whole thing, and you sear your chicken breast. Should we sear, do you all know how to sear chicken breast? Y'all say, oh yeah, has it ever stuck to your pan? Has anybody made a chicken breast that stuck to the pan?
Yes.
Okay, raise your hand.
Yes.
Okay, does it happen frequently?
Yes.
Raise your hand. Okay, then you all don't know how to make a chicken breast. So my point is, you have to let your pan work for you. You heat the pan, you put the oil in, you put the chicken breast in, you don't touch it, you let it get brown. We will turn no meat until when?
It's brown.
It's brown, it's time. Then it gets brown, it releases itself, you turn it over, it gets brown, and then you may take that pan and put it in the oven. Because a lot of times, when you are trying to make your chicken breast on top of the stove, by the time it gets cooked all the way in the center, it's overcooked on the outside and just as dry as what? Just dry as what? Shoot by the ash, whatever, I don't know. Oh.
Did you say ash?
Ash. Yeah. Oh, ash, not ass. Ash. Okay, so the thing is, cook like a restaurant chef. Just sear, finish in the oven, let it cook, like at 350 degrees for about 5 minutes. You have a beautiful chicken breast. So you have this soup. At this point, you've made a big batch of soup. Then Wanda, you've made a big batch of soup, right?
Yes.
Okay. Now, you haven't pureed it or anything. At this point, you've seared your breast. You can take that soup just as it is and put it over your chicken with some olives or something so you have a dish. You can also take the same soup, you can puree it, which we're going to do later, and you have that dish. You can take this same soup, take some tortillas, and put in there, and now you've changed the entire profile of your dish, and it's tortilla soup. You see? So the thing is, and especially if you're shopping for the week, what you do is you get your friend. Hi! Did they go find you?
Yeah, they did.
Okay, awesome. Here's our vegetarian that because we're going to have veggie stock and you weren't here, and I was like yelling out in the hallway for you. Like a banshee. So my point is that you use all of your vegetables, and when you're using your vegetables at the beginning of the week and you're putting them in your soup, you have this big vat. You can freeze some of it, you can use it, but you're using it for different things, you know? So Wanda, here's your spoon. I've been holding your spoon. We're going to taste this because, okay, how many of you out there have ever made a dish and you taste it when the people taste it at the table? Woo! I don't see your hand. Don't do that anymore. I'm glad that I don't see anybody's hand.
I was only preparing it for myself.
Because you need to taste your food. Now,
spicy.
It's a little spicy. That was his fault. He said to put all those chilies in
I
there.
need to judge a little bit.
Yeah, I think we need a little salt, don't you?
Yes.
Just a little bit of salt.
We need
Yeah, we're gonna
No more spice.
No more spice. But you know what? Once we puree all the vegetables, a little bit of salt, it'll be fine. I also had a red pepper. You can put the red pepper in there. You like it spicy? Trace.
That's good.
So you can add a red pepper. It's just a really great way to use all of your fresh vegetables. Okay, so here we have this. That's cooking. Now, we're doing a stew type thing. We want to make our soup interesting. So what we're deciding to do is all about the garnish. You know when you go to a restaurant, they have these beautiful soups, and it looks, oh my gosh, this is why I go out. This is why I don't eat at home. It's really easy to actually eat at home like that. So we're going to make what's going to be considered our relish, or something to go in it. We have canned beans. We have canned beans.
We have canned beans.
Okay.
They're bagged now.
Okay, we have canned beans. You're scared to sit down now. Okay, so we take our canned beans, and I'm making it for however many of you are here, so I'm making a lot. And then we have fresh corn, but this doesn't, I took the corn and I cut it off the cob, and let me show you how to do that. One, I'm actually going to talk you through it. Okay. Now when you cut corn off the cob, how do you normally do it?
I don't.
Oh, you don't? She's being honest.
That's right. Off of there.
Right.
I never cut it off.
Okay, so how would you think it would be done? Exactly.
I think I would go something like this.
Okay.
I think I would go a little deeper.
No, not so deep. Okay, so that's how you would do it. And you see that corn just flying all over the place, sort of? Okay.
So that's not right.
Right. No, it's not that it's not right. It's just that I have a better way. So you're going to lay it on its side. You're going to just cut it just like that. So all the corn is here. It just stays here. How many of you guys grew up eating cream style corn? Oh my gosh, isn't it delicious? This is a bad year to buy corn though, you know, because of the drought. It's going to be expensive. And then all the feed's going to go up for the animals and everything. Anyway, but let's not talk about that now. One of the great things about cream style corn, you think it's going to be really fattening. But if you have, you're doing such a beautiful job. I didn't give you the best knife, so it's not really you.
Oh, okay, thank you.
Yeah, it's not you. So you have your corn kernels. You did a beautiful job. So when you're doing cream style corn, you cut half the corn off, and you know when you get that milk, you go back with the back of your knife, you get the milk, okay? So that's all of that. Then you're gonna take, that's where the cream comes in. You're gonna take that, saute it really quickly. But you may take, let's say a 2% milk and a little bit of cream. Take these cobs, because this is like flavor gold, y'all. Flavor gold. I see you. I got an amen over there in the corner. You take these and you infuse them into the milk, and that becomes all of that beautiful flavor. And then when you're sauteing your milk part, you throw your fresh corn in and just a little bit of that liquid, which you can use for other soups. And then voila, it's not that fattening. You don't need all of that cream. It's just creamed corn. It's not cream corn. You got me? Right? You know what I'm saying? Okay. Right. Okay, so here we're going to take our black beans, we're going to add our corn. This was just a little demo. We don't have to, I just wanted to show you that. Okay, we don't need it. And then we're at the clean as we go. Because you know why, Wanda?
It's going to stay sanitary.
We're going to stay sanitary, but also, sometimes there are people out there that they will dirty every pot, pan, spoon, spatula, cake pan. They're not even making cake, but they're still dirtying up the cake pan. And so you clean as you go, or sometimes you have the hand. You have the person who helps you because they don't like to cook. Like if you came to my house, you're being the hand for me right now, right? But if I dirty every pot, pan, spoon, no, you forfeit the hand. There's a rule out there, and I have started it. When you dirty all of those things and you're the hand, I say you forfeit the hand. You can take your gloves off and walk out the kitchen and leave that mess for the person who made it.
I like that.
Right?
Yes.
Okay, so don't do that. So we have all of our beans in here. We're going to add more corn. And corn does not have to be cooked. Did you guys know that? You can eat raw corn. Exactly. So we have our corn in here. And we're going to add a pinch of salt. Yep. Now what I want you to do is, you're gonna put some lime zest in here. Okay. Do you all like lime? Yeah. Okay. Do you know the microplane? Yeah. This is an all-purpose tool. It's $12.95. It's the best $12.95 that you'll ever spend. I have no stake in the company. Oh, sorry, but I'm just saying, this is really awesome. I just don't want to, go on record like trying to, sponsor something. I don't really endorse it, and I don't really make any money. I'm just kidding. All right, so you're gonna just do your zest, and it's just the green part because the white is bitter. It gets, yeah. The thing is, a lot of times we need to decide, sometimes we have a little bit of salt, but using citrus and acid actually wakes up your dishes. It's like a peacock. Yes? Do I ever use sea salt? I do. I generally use kosher salt when I'm cooking, and I have my salt in a container like this. So often people will go and they start pouring it out of the container, but I can't tell how much salt I use that way, so I actually go in. I need to feel it in my fingers. So that's why I'm always going in with the salt. And a lot of times people think that the chefs are using so much salt, but when you do that and you actually measure that salt out, it's really not as much as you think. Now I'm not saying that a lot of chefs don't oversalt, because they do. Yeah, they do. All right, so you got that. We're gonna do a couple more. We're making this for all of these people. Okay. And then what we're gonna do is go back and juice, and so we have all of that juice in there, okay? Are you excited?
I am.
I'm excited.
I can make this.
You can make this. And what's your name, sir? Tony. Tony, you can make this too. Do you think you can make this? Uh-huh, that's right. I think right now we're just sort of playing, but we could have this in the pot in honestly real time. How long have I been talking? 10 minutes? I have 15, about 20. He was like, actually, been talking 20. Okay, but I've been talking, but you can have this in the pan like 15 minutes, and you go and you talk. I like to cook my soups for about 25, 30 minutes. It's passive cooking time, because all of those flavors are gonna meld. You're also are gonna realize that when you're making a big batch, it tastes so much better the next day.
That's right.
So, exactly, so all of those flavors marry. So that's why for me, you want to make a big batch of soup anyway, because it's just so much better the next day.
Am I doing one more line?
Yeah. So I'm going to add some scallions to our relish.
Also, if you can puree it,
Uh-huh.
enjoy cold.
Yes, yes. The comment was, when you puree it, can you enjoy it cold? Absolutely. You can enjoy it cold or hot. And if you're not dairy and you are vegan, instead of the cream, what you can use is a silken tofu. Have you ever done that before? Yeah, and it makes this beautiful texture when you puree it. All right, so we have everything going. We're going to add a little bit of salt to our relish. You're doing such a great job, Wanda.
Thank you.
Do you have one of those?
I think I may. It doesn't get used, but now I know that it's crucial to the cooking.
Wanda has one, but it doesn't get used. It's awesome. You can use it for cheese and chocolate and. All right, then we're going to go with the juice. We're going to add our juice because we don't need that much salt. All right.
Another one? Oh, that's good.
I think that's good. We're going to taste this. It's looking good. Another thing that you all can use this soup for is a sauce for an enchilada or something like that. Okay? All right, now, by the magic of television, now we will puree it. And by the magic of television, it's done. So I pureed it. I know you guys are like, oh gosh. You right, what's your name? Alvin. Alvin was like, I don't know when that's gonna get done. She's talking 30 minutes. Alvin, you're gonna get the first ball.
I will.
Okay, you're gonna hold me to it. Alvin, we still have a little minute to go, just a little bit. I want you to take your go. Yes, absolutely. We can use that. Yeah, we can use those. All right, so, do you guys want tortillas in your soup? Okay. Now what I want you to do, Wanda, is go in here and just crunch those up. We're gonna make those tortilla chips part of our relish for texture.
I wanted the fun job.
Oh, you wanted that fun job?
I'll do this.
You like the crunch?
All right, we're gonna clean up. Alvin, are you ready?
Yeah.
Almost?
I'm ready.
Does anybody have any other questions, like what you might do with this soup? Yes.
How do we judge tortilla chips?
How do you judge them?
There's a million brands of tortilla chips, so I don't know what's the best tortilla chip to use. Just go with the best that I like, or, Nice.
Isn't that good? That was best. This, for me, they need to be thin and crispy with a little bit of salt, right? All right. Now, another thing that you can do, you can also put your tortillas in the soup as it's cooking, but because I'm showing you various ways to do your soup, I don't want to put it in now because that means it's tortilla soup. So if you're making a big batch, it would be better to do it in your garnish. Exactly. Uh-huh. Yeah. You can also add a little bit of cream to your soup. That's not me this time. All right, so here we go. Alvin, you'll let us know if we need anything.
She's ready.
They have some. And then we've got some, in case you're getting it, they're down here.
I got it. Yes, ma'am, I'm good.
Okay, then this gentleman here, who's with the fun job, is going to help you.
Yes.
You're like, who's that?
I need to turn around and pay attention.
Okay.
You're welcome.
Now, when you're doing, we're talking about Thanksgiving. Well, I'm not. We are almost at Thanksgiving time, and if you're doing soup, or pureed soups are a really great way just to have when your guests come and to serve it in little demi-tasse cups because it keeps everybody from saying, when's dinner, when's dinner, when's dinner? Also, you can do it ahead. Okay, perfect. I'm going to use my blender because it's a Gombe moment as a picture. Do you all know what that is, a Gombe moment?
Yeah.
Yeah, it's Gombe, okay. Okay. So, all right. How is it, Alvin? Does it need anything?
No.
Really? All right. Do you need any more chippies in there, or it's good? Do you want more chippies?
I'm fine.
You all have any questions, please? Feel free to ask.
So you've had this 2 nights in a row.
Yes.
What do you do on the 3rd night?
All right, so I've had it, well no, I've had it, the first night, I've had it with chicken. So I've seared my chicken breast and I've had it without it being pureed. The second night, I'm pureeing it and I just might have it as a soup. And then I'm putting this garnish in it. The third night, because I actually made several chicken breasts, I'm going to use this soup as a sauce for a quesadilla with the tortilla and then wrapped it with a little bit of cheese and then it tastes differently. One thing that I do want to share with you guys, if you go online and you look up Spice Chart, International Spice Chart, you have the same dish, you change the spices and it changes the dish. So simply. You can add different herbs. You can take the same soup let's say you didn't put the cumin in it the first night. Take the same soup, puree it, add basil, and now it tastes a little Italian, right? So I'm always thinking that way. Especially when you have taken your time to cook, you know? Cook once, use 3 times. But it's not a leftover because you're already planning ahead. It's not really a leftover. Wanda, you are just awesome. So, simple ingredients, light, healthy, delicious.
Why don't you have to cook the beans? I thought you had to cook the beans.
Well, you can cook the beans from scratch, but these were from the can. You thought you had to cook the beans from the can?
Yeah.
Oh, really?
What were you going to use instead?
Do you want some cheese? Yes. Oh, okay. Any cheese? Anybody look for cheese?
Oh, I forgot the cheese. Sorry, I did y'all.
I'm so glad you asked. As a matter of fact, oh, that's right. As a matter of fact, I am working on a cookbook. My cookbook comes out on Election Day, and my mantra is vote, buy, cook. Yes, that's right. That's right. That's what I'm doing for Obama's campaign.
Where's the spoon? Right behind you.
So one of the things about my cookbook and why I was so interested in that the African American Heritage Tree. I'm already working on the second cookbook actually, but I have been reading a lot about the history of taking soul food from our diaspora and back to America. And the thing is, and why we talk about movement is so important, we moved a lot more when we were eating the food of our ancestors. We were moving, you know, and we also had a huge plant-based, oh, where's our vegetarian? Oh, this is not vegetarian, I have to give her this one. We also had gardens, which we called patches. So we ate a lot of vegetables and very little meat. So sometimes I think, yikes. That's okay, Wanda.
We got more. We got more.
Great.
Don't you worry.
Actually, let me have this on. So anyway, it's all really, really exciting.
Where can we get the rest of this?
Oh, you like it? Oh, awesome.
Where can we get the rest of it?
Is it on your website?
We can make one up and put it up there.
I have the recipe. I just didn't have time to print it, but we have the recipe.
We can do that.
Yes.
I got it.
And we're going to...
Maybe we can get the CBCF to put it on their website.
Actually, that would be great.
After the event.
Yeah, a little bit of that in there.
Cheese and this? No cheese.
Oh, okay. I think Trace has this side of the room. Trace, you gonna do that?
We're coming.
That's the vegetarian.
Trace, well, he'll get
and it's
that
chunky because, yeah, she's vegetarian. And let's see if she likes it. But this has chicken stock. Yeah. Any other questions? Anybody have any ideas that are popping up in your head about what you would do, or a soup that you would take, or that you want me to see how I can have different applications for a soup? Yes? A butternut squash. Butternut squash would be good, chunky. Also, if you're doing a risotto dish that's very prominent in our African American heritage. No, I'm just kidding. I just cracked myself up. Just all by myself. When you have these soups, you can actually use them in risotto dishes. So instead of adding, to make them really thin, instead of adding the stock at the last minute, you add the stock, then you add a very thin soup, so you have this beautiful soup that's coating the risotto. So it becomes part of the soup: mushroom, butternut squash, corn, whatever. Also, I make, when I make my grits, and I do the butternut squash, I make a stock with the butternut squash, or really thin, and I use that in my grits. So I would do half water, half of the soup, and just make them really kind of creamy like that. I do, yes. Well, I do, in my cookbook there is a recipe for, oh, butternut squash grits. Butternut squash. That's where I got that idea. Butternut squash and sage grits with, I want to say it's, a duck ragu, something like that. Yeah.
Now we have some more. We're running low.
Is there anything that I cannot cook? Yes. Let me think what it is.
Well, while you're thinking, can you do a hootie hoo for us?
Okay. No, there are things that I can't cook. I've learned so much from my co-host on The Chew, like Mario and Michael and even Daphne and Clinton. And the thing is, when there's something that I don't do well, I just keep doing it. I have that kind of personality. I just keep making it. For instance, when I was in culinary school and we were doing a dish, and it kept breaking and broke. I just kept doing it. I tend to make soups well. I want to look good, so I do things that I do well. Vegetarian no cheese? Vegetarian no cheese. Do you have any favorite dishes that you just say? Some of my favorite dishes? I love collard greens. But I love, here you go, you can put like extra chippies in there. I love them, though, the way that I make them and the way that I make them in the cookbook, different from my grandmother and my mother, is that I get the pot liquor. We were talking about pot liquor earlier. So I put smoked turkey and onions and vinegar and chilies all in the water, and I cook that for about an hour. Then I put my greens in. And I chiffonade them so they cook really quickly. They're only in there for about 20 minutes. So they have retained some of the texture. And a lot of times what I love to do is to take our food that we've been eating, but to say, how can I retain some of those nutrients? How can I have the same feel and the flavor, but still make it healthier? Yeah. I also saute my greens with little leaves of the Brussels sprouts and a little lemon on top. By the way, whenever you all cook for me, I love lemon. I love lemon, and lemon zest. I love the pepper. So I'm just a hint. Yes.
Now, going on down south.
I'm from Nashville, Tennessee, home of the Brandon Lock and the Titans. But go ahead.
South Carolina Gamecocks. But anyway, I remember my mother, but she didn't know nothing. So, but she would cook her greens for long periods of time.
Exactly. You do remember.
Wow.
Back in the day, our grandparents cooked the greens for a really long time. My mom cooked the greens for a really long time. You almost didn't need teeth to eat those greens. I know. You could just push that tongue right up in the top of your mouth and just dump it down. Yeah. Yeah, so I stopped doing that because actually you didn't taste the greens, you almost just tasted whatever the greens were in, be it fatback or, you know, that's what you were tasting. You weren't tasting the greens. Yeah.
My mother won't put that back in her greens anymore. She won't put that back in her.
Yeah.
So I won't eat them.
You won't?
No. Love fat back in my greens.
I can find that. Smoked turkey.
I can't do smoked. Yeah.
So now she uses hot cook.
Does she? Okay. Yeah, I'm not feeling toast turkey, the smoked turkey that.
But turkey necks are good too. I like turkey necks, but not.
I want you all to know that Wanda cooks in her crock pot. That's another great way to cook.
Quite often. Yeah. Anything that I can walk away from, put it together and walk away from.
Can I tell you another secret?
It's the easiest.
Yes.
She also cooks on a George Foreman in the office.
Don't tell anyone else.
But it works, right?
Yes. Keeps you on your diet plan.
All right, oh, I didn't put the cilantro in there. I forgot. That would have been like Padao.
Yeah.
Okay, I'm gonna go to her and then back to you. Yes. Short answer, no. And the question was, do I want to start my own restaurant? And not really. It's a lot of work, and at 48, working like 18-hour days, and when people don't show up, and I have to be the one there, I'm like, But if I could trust a chef and they can open it with my vision, I would probably do that. But I don't know if I could stay away. What would you say the caloric value? The caloric value? I would say it's pretty low. The only fat that we have put in this dish are about 2 tablespoons of canola oil, and then we have the chips, and then we have a lot of the fiber from the beans. That's another reason why I like to use the black beans. I mean, it's very low in calories. And let me talk a little bit about fat. I know so often we're always talking about low-fat things, low fat, low fat, low fat. But one, fat is a flavor carrier. So when you put olive oil or butter or lard or whatever into your dish, the flavor attaches to it. That's why it might be, if you did a gazpacho and a tomato soup, a gazpacho with no oil, it would be kind of bland. It just doesn't leave anything on your tongue, but it does, generally has oil. But fat is a flavor carrier, just the texture. Also, we are so focused, I think, on non-fat items or low fat that your body is still looking to be filled, and so you end up eating a lot more. So my whole thing, just me, I say no to nothing and yes to moderation. You know, that's how I eat. Emily's Abernathy, oh my God! Hold on! I went to school with her like grade school from when I was kindergarten up until like 8th grade. Oh my God. And now she's at Spelman. And then Bridget right here. It's just like homecoming. Okay, any other questions?
I have a question.
Yes.
Do you hang out with any of your former Top Chef competitors?
I do. I'm really good friends with, everybody talks about how hard Top Chef was, and the one thing that I got out of it were the relationships. And I do a lot with them. My biggest lesson in Top Chef, people always ask, wasn't it hard? The biggest lesson for me in that competition was delegate the work, not the vision. You know, so often as a woman, we're constantly giving away our power. You know, we don't talk a lot about that. But yeah, I keep up with Tiffany Dairy. I just did a dinner about a month ago in Dallas, which was really great with Tiffany Dairy.
And Mike Isabella has the restaurant.
Yeah, Mike has too.
Okay.
Yeah. So I keep up with him.
Well, you were great on the show.
Thank you. Thank you. Thank you.
Do we have enough for seconds for anybody that wants seconds?
Anybody who wants some more?
Will we pack it out? Raise your hand if you
have a confession.
All I know about tomatoes is Campbell's. That's all I've ever had.
Right.
It's very good.
Well, a second.
Thank you. Thank you.
Safeway.
Thank you. You guys are really awesome. It is such an honor to be here. It seems like every year when Black Tacos comes around, I'm always busy. Yes.
I want to tell you, my father is retired now, and now since he's retired, he loves to cook. So I most definitely need
just come up if they want to get seconds.
so I can give this to him so he can prepare it. Thank you.
No, thank you. And I want to say, when they put the recipe recipe up on the site. Even though it's a tomato soup, don't be afraid to change the vegetable that goes in it. The same base for this tomato soup you can use for a sweet potato soup. You can use for a butternut squash soup. If it's a green soup, take the carrots out because green and orange make an ugly color. Just think color. All right? I'm just saying. All right? You guys, thank you so much.